Hope Channel, changing lives.
If you can't fight for what you want, don't cry for what you lose. Once again, good evening and welcome to the program Wounds of the Heart. Today, my guest is already seated and we are about to continue where we stopped last week, Wednesday. And we're dealing with the topic, schizophrenia, something that people think is spiritual. But here we are here to discuss whether it's spiritual that should be sent to the church or it is mental that should be sent to the hospital. I'm so glad that today too you are joining me wherever you are, and it has been an amazing week, and I know that God is with all of us. Today marks the last day of September, and I hope and pray that God will usher us into another new month. Let me tell you something, that 1 year anniversary is coming off on the 4th November, and hope Wounds of the Heart will be 1 year old. And as I said, I want you to have a video of you, a sound, whatever, just 30 seconds or close to 1 minute, and tell us how impactful the program had been and what you expect from the next years ahead of us. I would like also to appreciate Slick Afrik for the fabric, Alpha Art for my flyers. God bless these people. They have been so much of help to this program. And if you are at home, it's on your diggy box, but if your friend is outside, tell the person that we are live on Facebook, Hope TVGH, and he can connect us on our YouTube page. You can also subscribe to our page and share the link for other people also to join in. As I said, my guest is already seated, and I'll go for this break. When I return, we're going to continue from where we stopped on the topic schizophrenia. Please don't go anywhere. I'll be right back.
Ye bompaya emuode ye bompaye esuegu nyankopon so na enim se nyankopon no oyem paibo tiefo nyam.
On 3rd October from 9 p.m., Hope Channel Ghana will be leading a virtual all-night service themed I Will Go. We will be seeking the face of the Lord. We will bring all our challenges and praises before Him, and we will fortify ourselves to go share His good news. At our last all-night session in July, testimonies were endless. The only safeguard against the power of Satan is found in the presence of Jesus Christ. Hallelujah. Christ has shown that He is man's friend and our deliverer. Make a date with us on 3rd October from 9 p.m. Remember to tell a friend that all of us will be a blessing. Thank you so much, and God bless you. Thanks for staying with me, and welcome back from the break. Mommy Mercy, good evening. How are you?
Fine, thank you.
Today I like your outfit.
Thank you.
And I trust everything is well. All right, viewers. Last week, Wednesday, we started with the discussion on schizophrenia. In case you just joined in, and we want to continue. Last week we spoke about what schizo is and some of how the forms of schizo the types of schizo. And I remember that we began with some of the signs of symptoms.
Yes.
I want us to continue from the signs and symptoms, because schizo, after the program, people should judge whether we should treat it as spiritual or as a mental illness that needs to be treated. So, my Mercy, over to you. What are some of the signs as you started last week, Wednesday?
Okay, so last week we were able to establish that there are positive and negative signs and symptoms, and then cognitive disorders, and you cannot base on just a few to diagnose someone. So we're going through some of the positive signs and symptoms, and we touched on hallucinations and the types of hallucinations.
Okay.
So today we are going to talk about another positive sign, and that is called delusion.
Delusion, okay.
And the delusion also has forms.
Delusion also has forms.
Has forms.
I quite remember last week we spoke about the hallucination.
The hallucination.
Okay.
And we said it affects the 5 senses on the body. So it could be visual, auditory, tactile, olfactory.
So can you just a brief, tell us the 5 affected areas and what
so we said the visual is about false perceptions of seeing things. Yes. Then we said the tactile is about feeling that something is either crawling on your skin or someone is touching you. And then we said we also have the auditory about hearing. So they may hear voices talking to them. It could be 1 or 2 voices. And then we also talked about the olfactory, the nose. The nose, yeah. The signs of smell. Yes, feeling that you're smelling something awful or extremely nice, and so following that smell. Yes, and then we talked about the gustatory one, about taste. So they may be tasting something different from what we think we're tasting. Okay. So that is therefore the hallucinations. All right. So
viewers, in case you just joined in, she just summarized the senses of the hallucination. Now, delusion. Let's go.
With a delusion, so we have types.
Okay.
We could have a persecutory delusion, an erotomanic delusion. We could have a mixed type. We could have, I've talked about the persecutory, the erotomanic. Then we could have a grandiose one.
Today, dear.
I'll break all of them.
Thank you so much.
Normal English.
Thank you so much.
The erotomanic one, someone may feel they are exceptionally loved by someone they are seeing, or someone exceptionally, or they exceptionally love someone. And it's normally towards a famous person, or someone that is high above their rank or something. So someone may be watching TV and they feel that the presenter exceptionally loves me. And so when he comes on set, he actually projects that kind of love towards me. And they may go to the extent of going to look for this person that the delusion is towards and express the feeling to them.
Seriously?
Before we come to that, let's establish what delusion in itself is.
Exactly.
It's a strong belief that is held by the sufferer or the patient. And not even evidence against that thought can change it. Yes, so once this person is feeling that the person they are projecting it towards is in love with them, even if you tell them he's married with kids and the person comes to tell them, oh, I have kids and I love my wife so much, it doesn't change the fact that
thought.
They think you love them. So that is that for the erotomanic.
Please, for the sake of my viewers who are learning, we are learning to help other people out there. That when we should see certain things in our families, our church, wherever we are, we need to know that, okay, these people or this person might be suffering from this because it's a sign or symptoms of what schizophrenia is. Fine. With this, so for instance, some of us sitting here, they'll say that there'll be somebody at home who probably, we are not part. We are not part. Who probably will be eyeing you. Let me use you. Will be eyeing you, and that person's no matter what the person thinking that how you are even talking to me, you are talking to the person.
Yes. So they interpret it that way. And even if I show them my ring or I tell them Mr. Richard is my husband or I have kids with him or nothing, even if he comes here to testify to that effect, it won't change that belief. So we say it's a strong belief that is held by the patient and it's not changed even when evidence is produced against that.
Viewers, you can join in with on our WhatsApp platform 0559680066. Just send your comment and your questions, or if you have experienced what we are discussing, you you can share with us so that I'll read them for people to know that indeed these things we are talking about are real and it's happening. Or on our Facebook page, Hope TV GH, you can leave your comment there and we'll find time to read it for you before we end today's segment. Please continue.
Yes, so we go to the next one, that is the grandiose delusion.
Okay.
People may feel they're exceptionally higher above everybody they are living with. So they could think maybe they are the president, or they are prophets, or they are too much important than every other person around them. So they start behaving as such. Those people could go to the extent of ordering everybody around. So in the classroom, you may find a student ordering the lecturer about, because they feel at that point they are the biggest individual in that circle. So that's how the grandiose one works. They may even think they are God.
People should worship them.
Yes, and they have to be worshipped or something. So that is a form of delusion.
This is when it has happened after 6 months. And now
yes, it continues through.
Okay.
That's why I said for you to be able to diagnose schizophrenia, at least there has to be the continuum of the symptom.
Okay.
Yes, over the period of 6 months.
So, Mercy, if that person is not like that, we are talking about a sudden change of character or behavior about somebody.
Exactly.
Okay, thank you so much.
So these people were not like that initially,
exactly,
but
that's wonderful.
these symptoms, which happens to be positive. I said the positive ones comes to add up to the person's personality, and the negative ones are ones that take out something from them. That's that for the grandiose. And then within the grandiose, we could have a religious kind of grandiosity too.
How?
So they may feel they are too Christian than every other person. So even when it comes to prayers, they are the ones that are doing all the serious prayers. Every other person that is praying below their volume, they think is not too much religious. Or if it happens that they are in church, they want to overdo everything in the church. If it's about reading the Bible, they want to read from morning to evening, and they feel they are too holy. Something like that. So that is for the grandiose one.
I'm sure what she just said, you started skimming your mind through your congregation or your local church, trying to pinpoint somebody who do what she's saying. We are not talking about that aspect now, but if you think that somebody, when the pastor mentioned any memory verse or scripture reference, that those people will read quickly, that doesn't make it what she's saying.
No.
But these are people who weren't like that, but it was there's a sudden change.
There's a sudden change, and you cannot even use just this to diagnose someone as having schizophrenia.
Thank you so much.
Yes, so that's for the grandiose. And then we have the persecutory. With the persecutory one, patients may, let me not just call them patients now, people who are suffering it
because
would start to think that someone somewhere is planning evil against them. So when they are watching TV, they interpret it as the person, the presenter, is doing something to harm them or someone close to them. And so they follow through. And when they realize that this person is the one doing that to me, they may go to the extent of going to confront the person about it.
Without any evidence?
No. That's why I said the presentation of an evidence is not a reason to cancel this form of symptom. So it's there. You know, even if you tell them that I am not doing, they believe you have done that to them. And they may react to it. So that's for the persecutory. Yes. So, and then we have the mixed type. The mixed type is a bit of
all these three we mentioned.
A bit of everything. So that is for the delusions.
Then comparing the delusion and the hallucination, which the delusion is higher than the hallucination?
I won't say higher, but they all have their breaking point. Someone may hallucinate to the extent that they start chasing whatever they are seeing, and then they are going to fight it. Someone may have a delusion that makes them feel they are the most beautiful creatures on earth, so they are always smiling to themselves, or ordering people around them and giving orders and telling people they're supposed to serve me, and I'm not the one supposed to touch the dirt, you're supposed to be sweeping around me and all that. So it depends on who is exhibiting what. Yes.
But it's Mercy, you are teaching me something this evening. I wish that, and I hope that my viewers out there also are learning. Because you meet people in the society or people, wherever you find yourself, exhibiting similar or same characteristics.
Yes.
We need not to just shout on them. We need not to just conclude by saying that they are too known, they are this, so I'm not going to work with them. We need not to conclude, but probably they need help.
Yes.
If for what we are seeing, it's...
Exactly. You know, psychiatry has actually taught me personally a lot of lessons about giving people room to
okay.
I don't just judge things like that, because when I am looking at someone, I look at the person with a psychiatric eye.
Okay.
That's what I say. And someone else may be looking at the person with a layman's eye. So
exactly.
If I am seeing someone that is doing all that, I may start thinking that this person needs help, but the person who doesn't have the information I have may not see it that way. So thank God for a program like this, and we hope
we thank God
the
so much
public is well informed about it.
Exactly. All right. So now we are still in signs and symptoms. So.
Yes.
Okay.
Now we're going to the cognitive.
Okay.
The cognitive impairments.
Okay.
With the cognitive, it's about how the brain is supposed to execute its task. So, you know, everything that we do is a process from the brain. So your brain tells you, you want to do a calculation, the brain is doing it for you, you're able to verbalize the correct one. Or you want to remember things, is the brain telling you. Or you want to undertake a project, is the brain telling you everything. But in the case of someone that is suffering from schizophrenia, there's a decline in performance. So that is a sign that should tell you that there's a problem that is looming. In children, it is seen as a decline in their grades. Or you may see that they're becoming a bit more reluctant in class. They're not able to concentrate more. Even in adults, in working adults, you realize they're not concentrating as they have to be. Or at a point in time, when you want them to remember something for you, it is difficult for them.
Okay.
But prior to that, there were people that were
very active
able to,
when it comes to,
remember things and talk about issues, know how to form correct sentences to the end. But when the disorder starts setting in, even their sentence formation also suffers. So an example, you could get someone say, I went to the bank to buy medicine, and you said you are checking my BP, say the truth and shame Azuma Nelson. Okay, you're lost. So you see how, I mean, how do you make any content out of this sentence? But there's something going on in the brain, and this is called a flight of ideas or flight of thoughts. So they are not able to follow through one full sentence and make it correctly. So the thoughts keep jamming in. So he started from, I want to go and buy medication, but where do you buy medication? From the pharmacy, but it's bank that came. And then he said, I want you to check my BP, and you're lying. Say the truth, and shame Azuma Nelson. And that is, they experience that too, because the thoughts keep jumping in, and it doesn't give them the correct information.
Mercy, you with this behavioral cognitive, as we call it, with the declining, especially children's school declining, parents should be careful about what we are saying, because if a child who is so brilliant start declining when it comes to academics, we need not to just put a cane. We need to probe more of reason why. And
ask why, they are not able to make the grades. It could be that there's something distracting the child in class. And it's nothing about they not wanting to listen to the teacher. Probably there's a voice talking to them. Or when they are trying to reason, they are getting thoughts flights. And so these things are confusing them. They are reading the notes, and the book is talking to them. Or the book, the information they are reading
is something else.
Probably they are reading about mathematics, and then the brain tells them that these maths that you are reading, when you finish reading, it is a calculation of your death date.
So they will stop.
So they stop. And it's not their fault. You go to the university and it's happening there. I mean, kids go through this stuff, but in the beginning, when we are supposed to see it early and do something about it, because we are not informed, we don't see it. And because we are not seeing, we don't get them the needed help. But one thing about this mental disorder is, the earlier it is worked on, the better for the sufferer.
Okay.
So I think we should take note of all that.
Exactly. So with those in a tertiary institution, a lot of people even are afraid to go home because the grades that they are making were not supposed to be, or they themselves are not expecting.
Yeah.
So at what time do people think, okay, do they come into in realization that this is what I'm doing?
One thing about schizophrenia and most other mental conditions is the sufferer may not realize it early. The sufferer may not realize it. There are some people, it depends on which symptom you suffer first. There are some people that could tell you that I think I can't concentrate these days. I think I feel too tired these days. I think I hear people talking to me. You'll be able to realize that and verbalize it. That's a plus for them.
Okay.
But there are some people who do not realize it. So before they realize, they are exhibiting the negative signs and symptoms, which actually makes it more difficult to realize the first one, the positive ones.
Okay. All right. So there's a question here. Please, I met a friend who is behaving in that manner, and it got to a time we started calling her Ellen White. I'm sure with the church religious aspect delusion. Yeah. Could she be classified as one?
Is a person conscious of what they are doing?
So it started where she wasn't like that, but according to it started, and they started calling her.
Some people could decide that they are choosing a lifestyle.
A lifestyle, okay.
And they go through with it. That is different.
Schizophrenia.
Okay, so before we go to the causes, we also have negative signs and symptoms. We said we have positive.
So you just spoke about the positive ones.
Yes, we are now done with the
positive. Okay, let's go to the negative.
So now go to the negative. The negative, as I said earlier, are things that the person, a normal person, would be doing in their daily life, but then when schizophrenia sets in, they stop doing it. One is talking to people or getting socialized. They stop. They stop taking care of their personal hygiene. They stop interacting with people. They may suffer a poverty of speech. It means that they talk less about issues. So you're talking with them, and the information you're getting are monosyllabic answers. It means they give one. How are you? I'm fine. No, I'm receiving two. Fine. Will you eat? No. Will you go with us? No. Did you just wake up? No. They don't, yes, they give you just one, or there's, even if they are forming sentences, they don't gather a lot of words. They concentrate on very few words to answer their questions because they don't want to interact with people. They don't take care of their personal hygiene too. Okay. Yeah, so when you look at a lot of people with schizophrenia, we know a lot of people who have schizophrenia, but I think we just miss the signs and symptoms. You're staying with somebody that all of a sudden doesn't clean his environment anymore, doesn't bath anymore, doesn't wash his clothes, doesn't talk to people, doesn't sleep well, doesn't even eat well. These are negative signs of schizophrenia. Okay. And so you have to be mindful of them.
I must say, whatever you are sharing me, you see, you've been seeing them and you've been seeing people going through this thing, and we just conclude by probably an insult or telling those people that tread on those words we use, and we are judgmental when it comes to certain things because they weren't like that, and all of a sudden they change to be like that. So this studies, although we are helping people out there, but then I'm learning a lot as a pastor, as I know my colleague ministers who are also watching. We need not to jump into conclusion and cover these things up with prayer. So assuming a parent will come to you as a pastor and telling you that my ward now doesn't learn, and he or she is declining when it comes to academic, then we do fasting and prayer for the child. But we are, from what you just told us, we need to probe and ask why, and probably send the person to the hospital first. If the doctor says nothing is wrong with the person, then I think prayers can come in. All right, so now you've told us about the negativity and the positive aspect. Right. Then what causes schizo?
Yes. Let's talk about risk factors first.
However are you going to do it?
The risk factors, human formation starts from conception. And before a woman gets pregnant, it is this body that is supposed to carry the pregnancy. So issues that are affecting this body could reflect in the baby's growth and development too. So somebody that is abusing drugs that gets pregnant gives it a risk to schizophrenia.
To the unborn baby?
Yes, to the unborn baby. So a mother that is abusing substances could put the baby at risk of schizophrenia.
Pregnant women or friends and loved ones who have people who are pregnant, please, let's listen to what she's saying very carefully, that they shouldn't abuse. They are putting the unborn baby's life into danger.
Yes.
That's another
and
risk,
there's a probability to all this. Some people could go through and nothing will happen to them.
Exactly.
Some do, and that is what is happening to them. So substance abuse, prenatal conditions before the pregnancy, some infections, could stem from viral infections, particularly herpes, syphilis, influenza, even influenza, could put a baby at risk of schizophrenia in the future. Because the formation of the brain is actually in the first trimester. The first trimester is the first 3 months of pregnancy.
Exactly.
So when the baby is now forming and there's an infection in there with the mother, and these things are going on, it could affect the formation of the brain. Last week, we were able to establish that some malformations on the brain could lead to schizo.
Yes.
So when you're forming a baby and you're doing drugs or you have an infection, these could be a risk factor to the baby's mental health. Yes. And then we have environmental stresses. Environmental stresses, I mean, an individual that is not having it easy with life, so there's a problem with feeding or enough rest, or even the suitability of the environment for growth could all be a risk factor for schizophrenia. So someone that is growing in a very harsh condition has a risk factor. But it doesn't rule out the fact that someone could grow up in a luxury and still have a genetic predisposition. You understand? So, and then we have genetics too.
Before genetics, with the environmental thing you just said, depression, pressure mounted on someone who always thinking about the family, thinking about himself or herself, they are risk.
Yes, they are risk factors for schizophrenia.
That's what the Bible says we shouldn't worry for. We shouldn't worry for. All right. So, viewers, we are about to go to genetic as part of the risk factors.
Yes.
I'll pause here. Let me go for this quick break. When I return, we're going to continue from the genetics as a risk factor, and we're going to learn more. You can still keep your comment and your questions coming on our social media handles, on our WhatsApp platform and Facebook page. We'll read them for you. Please don't go anywhere. I'll be right back.
We want to defy our family's decision and get married or elope. I need advice. What should I do?
Please, what should I do?
How do I tell her I cheated on her months ago? I need help. What should I do?
Okay, so for me, the moment I read the story, the first thing that came to mind was, wow, knowledge is indeed power. Sometimes we go through situations because we have no knowledge of how to go about them.
If you come from a home like that, you are likely to accept anything the outsider would, direct at.
The fact that we had an interesting ceremony where a priest prayed and all of that doesn't mean that magically you have turned into something else.
If he finds his way to God, a Bible-believing church, and he goes and he wants to change, nothing is impossible.
Is he giving his properties to charity and stuff?
Oh no, why? Okay, I think this is another discussion that we will not end today, so we'll not even go into it.
Real Talk, showing this and every Wednesday at 8 p.m.
Hi, welcome back from the break. At schizo, still we are talking about schizophrenia. Schizo and phrenia are two words together. She will tell us later on. But before she tells us about the genetics, there's a question for her. The question about the lady who actually the one the religious aspect.
Okay.
There's a follow-up to that. He said, please, sometimes she could fall asleep without saying anything or responding, but rather writing down for us to do this and etc. For the fact the whole day we will have to be with her without going to work.
She needs an evaluation.
She needs an evaluation.
Yes.
So please, she needs to be taken to the mental hospital ASAP for them to evaluate the condition.
Yes.
Thank you so much. Thank you so much. All right, so genetics.
Yes, genetics. Our makeup is for our genetic. The genes are parents transferred for. So if you have the predisposition, there's a statistics to that. Parents transfer genes to their babies. So if there's a parent that has schizophrenia, there's a probability that it could be transferred.
Probability,
to the child. Yes, it's a probability. It is not 100%.
Exactly, that's why probability. Okay.
Yes.
Okay.
And when you are related closely to someone that has schizophrenia, there's a percentage probability that you could also get it. They are not those infecting you, no.
Okay,
But there is the probability, because the genes that make up that person could be transferred from a grandfather. And you could be having a dormant one that has not shown yet. And so that person's will only happen to have shown earlier than yours. It doesn't make them the people infecting you. Even though in complicated cases we have shared psychosis where someone that is living with a person that has schizophrenia also starts believing the things that they are saying.
Okay.
So they say, oh, your brother is a wizard. Your brother is a wizard. So they keep telling the person they are with this, and they start believing it. We call it a shared psychosis. The person is only getting the same symptoms, believing that because of what the other person is telling them. Yes. So that's it. And with the twin theory too, the probability that a twin could also suffer some if the first one has schizophrenia is 50%. It is only because they had the same genetic makeup.
If the senior of the twin
is suffering from schizo, or the senior, any of them,
from the schizo.
Yes.
The junior,
probability that the other one
50%.
Is a 50%.
Okay.
But this is just predisposition.
Okay.
What it means is, if the other person that is not infected knows about the condition and live a lifestyle that could help him prevent the disorder, they may have a dormant gene, but it will not manifest.
Okay.
Yes. So you see, lifestyle also plays a role here. So then we jump to the causes. So somebody is at risk of schizophrenia or has a predisposition to the schizophrenia. Now, if these people that have the predisposition abuse drugs, then that can cause schizophrenia. If somebody that has the predisposition...
Wait, somebody who is showing the risk factors?
Yes. Risk factors doesn't mean you are showing symptoms.
No. The one who have the risk factor, that person is having a risk factor that if there's a trigger, that person...
Yes, that could happen to the person. So unless there's a triggering issue that is causing the person to exhibit the signs and symptoms, the risk factors could be there, but these people are fine and they are functional and they are doing their own thing. But then when the causes come in, the person is abusing drug or the person suffers a trauma, that causes them to break down mentally, then the symptoms could manifest. Or if this person goes through too much stress more than they can accommodate, then these people could have the symptoms. Or if this person happens to have an infection that goes into the brain, it could go and trigger the disorder.
Mercy, I don't know what to even say. Then, which means that we human beings, no matter how we are, should be very careful about a lot of things.
Everybody on this planet is prone to schizophrenia. Everybody. Because you don't know how your makeup was. You could be fine. All your siblings or this generation you are seeing could be fine, but it could be that he had a great-grandfather
who had something,
who had it, and he may have died, but then he transferred the genes,
genetic,
yes, down. So you cannot say that these people are those who can get. All races on this planet can get the disorder. Asia, black, white, yellow, everybody.
So if the risk factors are there and even drugs can trigger, then we need to be very aware of even abusing drugs.
Yes, even prescription drugs.
Even?
Yes, even prescription drugs, some of them could trigger that. Yes, so that is why you have to be careful. You can't be too careful about schizophrenia. Trauma can cause it. Recreational, they call it recreational drugs, but then alcohol is something that can trigger someone's schizophrenia. So you may think, oh, we just go and we drink on Fridays and that is our lifestyle. But then it could be risky to you. Someone can smoke all his life and not get it will not trigger anything. But another person does it for just 2 days and it's a full-blown psychosis. They are seeing things, they are hearing voices, they are believing they are God, or they believe they are the angel of death. Do you know what that means?
Unless you tell us.
The angel of death means he's supposed to be the one killing people. So most of the serial killers, they have delusions that makes them think they are in charge of killing people for God. Yeah, and that's a form of a grandiose delusion.
All right, Ni Okanlami, Pa, keep it up, good work, Shalom. Thank you so much, bro. Nana Ijewa Kodi, nice topic. Nana, thank you so much for that comment.
That is my mother.
Yeah, okay. Then thank you, Nana, Mommy, thank you so much. And Gabriel K. Jaban, nice topic. That's wonderful, Gabriel. Gifty is watching with us also. And you can keep your comment and your question coming because we are learning. And I know that you have a pen and paper somewhere that you are writing tips that you need to help other person or somebody also overcome what we are going through because we don't want people to suffer schizo. It's not a good thing for us. So now, as you're telling us, the causes, you made mention of even drugs and what else, or trauma. Is it when somebody go through trauma, when somebody is highly depressed, that person can?
Yes.
Okay.
Or stressful lifestyles. I mean, you're not getting enough rest. You are always on the go and you're stressing your body so much. If you have a risk factor, you could also exhibit the symptoms.
And okay, continue, please. Sorry, but continue.
And then childbirth and its stresses. There are some people that suffer postpartum psychosis. When they give birth and they get stressed out too much, or they have a fear about the birth, or there's something that happens around the childbirth, it could push them into psychosis. If the symptoms are able to diminish before a month or before 6 months, that's okay. But if it continues to 6 months and beyond, then that is almost a full-blown schizophrenia. Yes.
So the causes are what will cause the mind, the trauma you will go through, a broken heart somewhere, depression can cause even what is joyful than giving birth. But even after giving birth, somebody can also get herself locked up with schizo because if that person has a risk factor, probably genetic or whatever going through.
Yes.
Oh, God have mercy on us. Mercy.
Happen.
But as a mental health practitioner, and you mean seeing sick people, what brings most of these patients to the hospital? The causes. What are some of the one that is
the highest cause
of schizo?
I'll say genetic. Because there are most cases that come, and these people do not have a history of abusing drug or a stressful environment or anything. And then you say that's it. So the family will tell you, oh, she's been fine all this while. We have never had this case. Or he's even a good person. He's the most lively in the family and all that. But then it happens to them. And then I'll also pinpoint substance abuse.
Okay.
Substance abuse, marijuana, cocaine, And alcohol. Alcohol, people think it's nothing, it's just a drink. But then alcohol causes a lot of damage to the brain in the person that has schizophrenia. That's how you'll be able to tell if somebody has a problem with. You see, when people take alcohol, most of them still function a bit. But you realize that there's this person out of your group of friends that whenever you go out and drink, he becomes erratic. He's punching people or always fighting people. And all of a sudden, he's always violent when he drinks. Please advise him not to.
To drink
not to drink.
Would they listen?
That is a problem. But I mean, maybe we're not even talking about it because we didn't know.
Okay.
So for our viewers, if there's somebody that's at the slightest taste of alcohol or marijuana or something, they start exhibiting these things, let them know that they could have a predisposition to schizophrenia. And that is why they are doing that. Let them know. Some people, when they get the information, they act on it. And there are some people too that will not mind, and in the end, it gets into a full-blown schizophrenia.
Okay. There's a long essay here for you, so let me read it for you. Good day, Hope TV. Good day. I like this topic, and I can relate to someone who had it some time ago. Let me share my experience. She was a neighbor, and I was sharing in my direction, saying things like, "You think you are more beautiful than me? Let's go for a beauty contest." And she was a woman in her 40s and I was 20. So, of course, there was no way she could compare herself to me. But from last week's discussion of what Madam said, they hear voices, and so if I had this knowledge earlier, I would have ignored her, because it was later realized that she had a problem. Shamefully, I responded, and today, listening to this, I regret and feel ashamed. But she received treatment and she's better now. Jennifer from Accra. Jenny, yes, it's good you share this thing. A lot of us also probably might also have ignored and had even go ahead to compete with set people. Yes. And today we are learning. And this program is just to help us to heal somebody, even to heal ourselves, to heal, also help us to heal people who are wounded in heart. Because the woman was suffering because we don't know the signs and symptoms, so we probably ignore them, and I don't know even the insults sometimes raised on these people.
Yes.
And it's good. Jennifer, thanks for sharing with us, which means that they are real.
Yes.
And now, is that the woman has received treatment and she's better now. We thank God for that. Now, now that you are done with the causes of schizo, what are some of the effects? What are the heart wounds of schizophrenia?
You see, if we are informed about it, even when we are informed about it, the fact that you see a loved one suffering from this could stress you out as well. And when you don't have the information at hand to handle it, you may feel like ignoring them, or maybe leaving them to their fate. But if we have the information that we have now, you'll be able to let these people get close. You could get close to them, find out why they are doing that. Because I mean, in an instance where someone is insulting, so you are the one that is chasing my husband. You are the one, and you don't know this person from Adam, but then they believe that you are the one that is not making their husband stay in the house. And you don't know who they are talking about. You don't even know them. And if you get close and you're able to establish facts well, you may realize you are talking to somebody that has a delusion. Or is exhibiting a sign and symptom of the beginning of schizophrenia. But then, because you are not well informed, I mean, you may even go ahead and start fighting this person and think, hey, they are disgracing me. Someone fought me in a car because he said I stole her crown. I stole her crown, yes. By then I was new in Accra. I had gone for clinicals and I was returning in a mufti. He said, "You stole my crown. You stole my crown. The beauty pageants are with you. You stole my crown." I have never entered any contest about beauty pageants in my life. But I was a psychiatric student by then, so I knew what was happening. So I just had to avoid the situation and find a better place to be. But most people would fight this individual.
But let's know, from what the woman said, if you could have found yourself in an area where they don't want to hear anything like stealing,
yes, they could have lynched me, yes. It could have happened. Yes, so do not go fighting people who are making accusations in the air. You don't know what someone is suffering. You don't know. So don't just go, don't welcome every fight that you meet outside. And with families, when this thing happens, with the negative signs and the symptoms, you see, it makes them withdrawn. And they stop taking care of their personal hygiene, they stop eating, they stop sleeping. When someone is doing this in your house, it gives the family some form of stress. So what you have to do at that point is to take those individuals to get the help they need and further go for a family therapy.
Okay.
It's a form of one of the forms of treatments that we give. Family therapy would let each individual know what you can do to help the situation after all of you have been called and you have been given the information about the disorder and how you can relate to this person even with the symptoms. So you're able to heal as a family and inculcate the person into the family system.
Okay.
Yeah.
All right. Before you still not tell before you go to the effect, he said, "Wow, nice program. Please ask the doctor for me that how can you control the neuron psychiatric? Is it pertaining to what we are discussing?"
Yes.
So when we get to the diagnosis and control, helping out to you. So DJ Biology, we're going to when we get to the diagnosis and how to control treatment, you're going to talk about it for you. All right. So the causes. The effect, the heart want.
Yes, and with couples, you could have a couple that is exhibiting this, and if you are married to such a person, at a point in time, you may want to dissociate yourself from them because you don't know how to handle all this. Because there's this person that you are staying with, and all of a sudden, nothing you do seems to be enough for them, and then they start making accusations that are baseless about you. If you don't know this information we have, you may start ignoring them or you may move away from where they are. And this is a person you're married to. So at this point, as a husband or as a wife, you should probe further and let this person get the needed help.
Mercy, let me cut you short. Mercy, do you know why I was looking at you like that? You see, there are probably with what you're saying with the couples, how it can affect marriages.
Yeah.
Every counselor, marriage counselor, should be abreast with these things, because somebody might come to you and the complaint was, my husband is behaving. My husband is always complaining that I go to work, I stay with my boss. I like that baseless argument or what we are saying. We shouldn't just conclude by the normal counseling sessions we have. There should be a probing, asking yourself. We should to probe further to ask more questions about this. When we think that it is getting somewhere, we need to let the man see the psychiatrist. I don't know, but what would be the advice? Because we are talking about the effect, and it can destroy marriages.
Yes.
So what should they do as we are talking about to what effect?
You know, in psychiatry, you have a referral system.
Okay.
So if you are the one handling the situation, you are a counselor, so you find out this. I think it's prudent that you let a psychologist talk to this person. You could establish later that this person that is so much convinced that the wife is having an affair has no evidence at all. But they have a strong conviction that they are cheating, or they have a strong conviction that somebody wants to harm them through the wife, and that is why they are always fighting them. And so if you probe further and you refer them to the psychologist to help out, we'll be able to save the situation early enough.
All right. I believe it's time churches get deliberate
with mental health education. And because pastors deal most of the time with people, we should be abreast with issues such as this to be able to make proper referrals. Thank you, Mrs. Labi and Pastor Bideba. God bless you, Senior. God bless you for your post and comment. Because I don't know what to say, because there are a lot of pastors who probably had made wrong comment or solutions to their church members because of this thing. And sometimes when a pastor or a counselor is not well abreast with what we are discussing, it will lead to kind of confusion or something in marriages. I think that a lot of things happen in marriage, especially when a man it's under pressure. Yes. It can, if the man too also have a risk factor somewhere or genetic factor, it can trigger what we are saying. Yes. So as Nana is saying, thank you so much, and we need to. I think we should organize for pastors to have workshops on set things, mental, that even the DSM-5. There are a lot of things in that we pastors should know to be well abreast of. All right, Eko, I'm watching from Italy for such a wonderful program. Thank you so much, Enoch Amo. Thank you so much, Adria Manson. Well done, sis. Dorothy, God bless you. You know, and she'll know who she's sending. All right, so tell us more, because we have few times to end. Okay, so with the effects. Now we talk about the marriage. In marriages and in families. Okay. You know, when we don't understand the condition, we may assume that our family members are being a nuisance to us. And we may ignore them. And at that point where you are ignoring them, it only compounds the issue, because you're not getting help. You're not getting the needed treatment. But then, these signs and symptoms are treatable. Or at least, there are people who recover completely. And then there are some people who may have some symptoms, but then as time goes on, they become functional with the help that they get as treatment. So families that may be suffering, with diagnosis, we're supposed to diagnose the whole family. So if a family happens to be suffering from this, they should seek the right help. Can a whole family suffer from schizo? When I say the family is diagnosed like that, if one person is diagnosed, he becomes less productive. If there's a sister that was working, she has to find time to take care of this person. If there was a husband that was always at work, he has to be home early. If there were kids, they need someone to take care of them in place of the person. So when we diagnose a family, like that doesn't mean all of you have it. What it means is it has caused a dent in your family, and we have to find a way of helping each other to be able to solve the problem. So that is it for the family, and the marriage. And what else can socially, exactly. Socially, it could bring violence. Or yes, because we are here and one of our colleagues all of a sudden starts exhibiting the signs and symptoms, or he starts insulting. If I am not informed, I would respond to it. Exactly. And when I do, there could be chaos. Most of the people that start chaos are actually patients, but we don't know. So you could see that this particular person, when it comes to violence, they are the persons that are always leading the group. And they are, let's go and fight them, let's go and it means, Roshi, why don't you have a bit of fear in you at all? It's a problem. Let's see. The problem if you don't have the sense of fear at all. There's a problem, because as human we need to have a bit of everything. So there's this person that's when he's seeing machete and he's coming, he sees blood and he's happy, or people will die, but then he feels he's in control, and if people die, and so what? I mean, this person has a problem, and they will influence people around them to also help in their quest to destroy life and property. So we have to, as a society, we have to be concerned, because it could affect us too. Economically, productivity could go down. With the social aspect, we need to be very careful of following people, especially when it comes to route and stuff like that. Exactly. Because if that person is leading and he or she doesn't, she's not afraid of anything. There's a problem with the sense of reasoning. So the cognition has trouble. But then because you don't know, you think, oh, freedom fighters, oh, we have a cause, we have to kill. And he's the one chanting and you're responding. You are compounding someone's sickness.
But with, you said most people, but with a case where we are human, so definitely we need to have a bit of everything.
Yes.
But well, because of the love I have for something, I would die for that.
You could decide that I'm so passionate about something.
Mm-hmm.
But then if you are so passionate about something that you can kill another individual for that and not feel remorse,
okay,
there's a problem.
Okay. That guilty aspect, the remorse aspect, that what you've done is wrong, okay.
There has to be that sense that is triggering you to say, we have to solve the problem, but then it has to be in a more conventional way.
Let's say our time is up.
Time is up.
Mm-hmm.
And we still have a lot to cover.
Viewers, our time is up. What do you think? Should she come next week to end with us?
Yeah.
So Mercy says she's going to come next week to end with us, because let's see. Let's hope and pray that next week she will be free to come, because if she needs to come and end the schizo. Let's pray for her to get time for us to next week to come and end the schizo. Sorry that because her time is up. Our time is up, actually. We ended with the social aspect. And we have the economic and what again?
We have the economic
and
then we have the spiritual one.
The spiritual one.
The effects are biopsychosocial. So the person's individuality, then the social aspects, and then the economic.
Okay, so
everything.
And after that we go to diagnose and how to help control.
The treatment
available. That is what a lot of people are also looking out for, because they need to know how to help
solve the problem.
Friends and loved ones, viewers, charity viewers. We started schizo last week, Wednesday. I never know that it's going to take us 3 weeks. 3 weeks from now, she's trying to get it done with us. It can take a lot of.
It would take a month.
A month. All right. So. So we are saying that we are hoping and praying that next week, Wednesday, she will have the time for us. It is not a must on her side, but let's keep our fingers crossed and let's pray that she will get time to come and end it with us. We don't know, but let's hope and pray. And but well, Hope TV. Will be doubled. I want you to have a time and make a time with us. Mark it on your calendar, 3rd October, this coming Saturday, 9 p.m. You need to be glued to your TV set, that you can join in our prayers and testimonies, that yours also will be on the way coming. I believe in that. And let me use this platform to also appreciate all my church viewers, those who are making this program a success. God bless you. The comments, the questions, the contributions is enormous. God bless you for that. And as I said, 4th November, Wounds of the Heart will be 1 year. And if you have anything to tell us, you can do a video, 30 seconds or 1 minute, to share how it has impacted your life and what you are anticipating from this program, so that we can also serve you well and help you heal the wounds in your heart. And also, Slick Africa, the fabric, God bless you. And I know on an anniversary, you're going to be there, you're going to represent life. Alpha Art, God bless you for the flyers that you've been doing for me. God bless you for the flyers. And we're still looking out for people who can also help sponsor this program. If you have anyone, you can let us know. If you also want to sponsor in your widow's mind, we will be very glad to accept it to move this program very far. Auntie Mercy, God bless you so much.
Bless you.
You're such a wonderful lecturer. For the sake of this, let me call you Professor. You're such a wonderful lecturer. Because last week somebody sent a message that he's a nurse, but from last week he is now understanding what schizo means. And it is God's grace, and we continue to pray for you that God should give you the strength to help us understand these mental issues that are happening. And we hope and pray that when a church needs her to
please, you can let me know. She should be ready to come and talk to the church about these mental things we are talking about. Have a program and let's invite her to come and help us out of that. We are not done yet with schizo. Next week, I'm trying to get pastors around to talk about schizo in the spiritual aspect when she is done. If we promise that if she comes in. I have been your regular host, Pastor Daniel Abedu Bidiaba. I'm out.